Shanti and welcome back to Ek Mulakat. As you know, we bring a special guest to you each time on this show, someone from a different walk of life. Our special guest today is Dr. Sonia Rawat. She's the Director and Senior Consultant at the Department of Preventive Health and Wellness at the prestigious Sri Ganga Ram Hospital in New Delhi. Dr. Rawat has lived in the UK for 17 years, where she trained and worked at NHS, the National Health Service. She also has an MRCP, membership of the Royal College of Physicians. Om Shanti, Dr. Rawat.
Om Shanti.
And welcome to the show, Ek Mulakat. And welcome to Godlywood Studio and our headquarters of Brahma Kumaris in Mount Abu.
Thank you for inviting me.
Dr. Rawat, today I'd like to start off by asking you the role that spirituality plays in medicine. We can first talk about maybe spirituality and the patient, and then maybe we can come to spirituality and doctors. How important do you think is spirituality in the life of a patient?
Spirituality is very important because we are talking about the mind here. Mm-hmm. We are talking about mind management here. Mm-hmm. And to us, mind matters a lot.
Yes.
So it is very important that we actually think positive. And by thinking positive, we can actually achieve the impossible. So that's what we are doing it on a regular basis in my department, that is at Department of Preventive Health and Wellness at Sir Ganga Ram Hospital, New Delhi. It's a very prestigious hospital. Mm-hmm. And our chairman, Dr. Rana, has given me the role that you have to actually look after this prevention of people, you know, so because prevention is very important. Nowadays, what exactly is happening is we are treating diseases like if you have diabetes or if you have high blood pressure, people will actually go to their respective doctors and they are getting treatment for the same. Mm-hmm. But nobody is talking about prevention. How can we prevent these diseases from happening?
Right. When you say prevention, we're talking about before the disease progresses into a stage where it's probably, not treatable. We can stop it even as it's happening.
Yes, we can definitely look into that. We can look into the risk factors, and depending upon that, we can actually guide our patients accordingly in order to do their lifestyle modification, in order to do their well-balanced diet, heading more towards spirituality, heading more towards mind management, heading more towards positive thinking, and having a positive attitude towards life. And through that positive attitude, they can definitely prevent that problem from happening.
Doctor, you mentioned a couple important things here. First, you talked about lifestyle. Do you see an increase in lifestyle diseases these days?
Yes, lifestyle diseases are very much on the rise. And nowadays, you can see that if you actually tally the previous reports, the recent reports are definitely showing that diabetes is 4 times higher.
Is that right?
And nowadays, even the small children, the small kids are getting diabetes. Oh. So it's basically the lifestyle, because as you can see that they are sort of becoming like couch potatoes. They are not doing the regular exercises that they used to run around in playgrounds.
And I think it's all the gadgets we have today are to be blamed for
that. It's the social media, the gadgets, the video games, the phone games that they are just taking on to. Definitely not doing the exercises that they used to do before. So earlier we used to sort of keep on calling them from the gardens and they wouldn't come. And nowadays we keep on asking them to stop playing on the phones, but they wouldn't listen.
So it's basically a different scenario.
It's totally a different scenario. And these people are definitely going into these lifestyle diseases. And with our busy life, as you can see, stress is on the rise. People are definitely wanting more and more, whatever, money, respect, power, and they are actually forgetting to have a balanced diet, sort of sleeping on time, getting up on time, sort of looking after your health, reflecting back, rejuvenating yourself, and, sort of rebuilding maybe your relationships, maybe your communication, because it's very important that you have to actually open up to somebody. You have to let your emotions flow. You have to talk to somebody, maybe it being your patients, be your family, be your loved ones.
Are you seeing this in India as well? Because this is a very common thing that happens overseas in European countries or Western countries where they don't have anyone to talk to. And that results in a lot of diseases. But is that happening in India as well?
Yes, I can see that with these ongoing social media, with these ongoing different WhatsApp, Facebook, etc., which is coming. That is actually, we are stopping talking to our own people. As I can see as a doctor, patient-doctor communication is very important. Patient-doctor relationship is very important. It's been seen that if the doctor talks to a patient nicely, half of the disease is definitely gone.
Right.
So it's very important that communication is very important, and we are losing our communication. And because we are losing our communication, we are falling prey to all these psychiatric illnesses like depression, anxiety, stress, etc., etc.
And I read somewhere, or I heard that depression is on the rise, even in children these days, which was something which was unheard of, several years ago. So that is quite alarming too.
Yes, depression is on the rise in children because they cannot talk to their parents because their parents are busy, either earning money or looking after their family or cooking food or whatever. And the children themselves, when the mom has time for the child is busy doing whatever, playing video games or doing chit-chatting or whatever. So that communication is definitely getting loose between the mother and the child, which was definitely there before. That mother was actually feeding the child with their own hands. And that communication was definitely there, as you can see, that mother is making food for the child with lot of love, affection, and she's actually feeding the child. That is definitely going.
So, Dr. Rawat, can we say that spirituality is definitely helping patients? Because there are two aspects. One is, how the patient feels about his or her disease, and then there is this treatment that the doctor gives. So have you seen that because of the various programs that you have implemented, is there a change or a shift in how the patient responds to the treatment?
Yeah. What we have done at the moment is we've actually launched chair yoga sessions along with our yoga guru, Mr. Ramesh Chandra, in Ganga Ram Hospital. And these yoga sessions are actually having certain pranayama and meditation techniques where we actually emphasize upon the spiritual being, that, the positive thinking that my disease is getting better, my disease is getting better, and my disease has got better now. So we are actually emphasizing these patients. And there are a lot of areas where I tell my patients who actually have problems with sleep. Say, for example, not sleeping, insomnia is very much on the rise, as you all know, because of the stress-related issues, etc., etc. And I always tell my patients that, look, sleeping pills is not the long-term,
not the right option.
Not the long-term option for this. You have to tame your mind. You have to do sleep hygiene. Sleep hygiene is very important.
This is a new term. Can you please explain that?
Well, sleep hygiene is basically, we emphasize a lot, say, sort of getting up on time, sleeping on time, sort of using your bedroom only for sleeping purposes, no TV in your bedrooms, and not sort of fighting with yourself that, look, I'm not able to sleep, so I'm fighting with myself. Then you're not able to sleep again, and then you get frustrated. So if you're not able to sleep, just get up, read a book, go to your living room, watch TV, and then come back and try to sleep again. Don't use sort of tea, coffee, alcohol just before going to bed. And you have to actually take a sort of short nap, not vigorous exercise, but just strolling in the garden or something like that, which will actually make you feel weary and make you feel sleepy, and then you can go to sleep. Sometimes a hot chocolate or hot milk is also very soothing before going to bed. And sometimes if you're actually taking a hot bath, sort of that can actually make you go to bed. And at times I have seen that if you just write, say if you're talking about spirituality, we all know that our mind, soul is actually the main thing that we're talking about. So our body is just sort of what we are wearing at the moment. Say, my name is Dr. Rawat, so that's my body. But my soul, as you know, it never dies. And we are talking about the soul. So it's basically the soul. If you just write, I am a pure soul, I'm a pure soul, and I can fight this insomnia, I will be able to sleep. So that positive thinking, say for example, if you write it 20 times or if you write it 30 times each day, you will definitely see that maybe in a week's time, your positive thinking will actually get rid of insomnia to some extent.
How nice. You have given us such wonderful tips because, you know, like I said, a lot of people have this problem, not able to fall asleep. And I'm sure our viewers out there today are going to appreciate everything that you have told us today. Can we now talk about, you know, spirituality in a doctor's life? Because no matter what, I mean, doctors are considered next to God. But at the same time, you know, there is a lot of stress in the life of a doctor as well.
Yes.
So how do you see spirituality helping a doctor be a better doctor when it comes to his patients?
See, spirituality, as you said, that stress is there, a lot of stress is there in a doctor's life at the moment. And as you can appreciate, the violence against doctors is on the rise as well. So it's very important, as I said before, communication is very important. If you tell your patients, look, these are the adverse effects, these will be the problems, these are the side effects, and if you don't get better, do come back to me. That communication is very important between a doctor and a patient. If you explain all that to the patient will know, look, the doctor told me this will happen, and the doctor told me it's not working, so I have to ring the doctor again, or whatever. So that communication is very important. Secondly, anger. Anger management is very important.
For a doctor.
For a doctor. Because anger, if you put a D in front of anger, it becomes danger. So that is very important. Nice. If you actually get yourself sort of that, okay, fine. If the patient is getting angry, then you quieten down. Because as you know that loha lohe ko kaatta hai, you know, but thanda loha bhi garam lohe ko kaat sakta hai. So that is also very important if you keep that in mind. So again, worry, ego, anxiety, you know, these sort of things should be changed to happiness, love, you know, giving nature. That giving nature should be there in a doctor's life. And again, I must emphasize that all personal and professional relations should be different. So you should not bring your professional problems to home, or you should not take your personal problems to work, because that will aggravate matters.
Yes. You know, you're so right, because when we look at nature, you know, the birds and animals, they are healing themselves.
Yes.
You know, they don't have to go see a doctor to heal them. Also, I was wondering if you can talk a little about, you know, the role that you already mentioned a little bit, but positivity. I heard in some countries that before the patient comes in, say for surgery or something, they actually have a program. Maybe it could be for a week or 10 days where they are, you know, going in some sort of training, like positive training with the patient. And they're seeing better results with that. Is that something that you're following in your hospital?
I am just doing preventive health and wellness. So the patients come to me, we talk to them, we give them certain tests, we find out whatever problems they have, whether it be breast cancer or prostate cancer, lung problems, heart problems, diabetes, blood pressure, etc. So I'm not dealing with the surgery patients, but I'm sure, I mean, bringing the positivity to the patient's life will definitely help them to feel positive and be relaxed, and the hormones, the happy hormones will be released during the surgery, and they will help for the surgery to be successful and for them to heal better post-operatively.
Can you talk a little bit about preventive medicine, because why is it important in the life of a patient, and what does it really do?
Preventive medicine is as you are aware that we practice it a lot in the UK and US. Definitely lacking in India, because in India the priority of these people are basically roti kapda makan, you know, and if they are falling ill, then only they'll go to the doctor. At times, you know, if you tell these patients, if for example, if a laborer is there and if you tell him, look, go to the doctor, get your blood pressure checked, he'll probably say, look, why should I go? You know, I'm feeling better, I don't have any symptoms. And during that period when I'm sort of going to the doctor, standing in the queue in the government hospital, I would probably earn this much money. So, you know, I can earn more money, sort of spend more time with my family, or, you know, relax.
So, what steps are you taking to bring this awareness in the life of a person? In terms of, you know, that preventive medicine is good for you. You know, don't wait until you get a heart attack or a stroke. follow. So are there any particular steps or measures that you're taking?
The government is taking a lot of measures with Modi ji's introduction of the Fit India.
Okay.
That is what they are emphasizing on, preventive medicine. So they are trying to catch blood pressure patients, they are trying to catch diabetes patients. And as I said, diabetes is on the rise, and it's a silent killer. So obviously, once they catch hold of this, then these patients, you're saving their lives.
Sure.
Because 5 years or 10 years down the line, these patients will end up having a heart attack or a stroke.
Right. Is this your first time at Brahma Kumaris here in Mount Abu?
Yes.
So we'd love to know, what was your experience like the first time you walked onto the premises? What was it like? What did you feel like? What was it that impressed you the most?
Beautiful compound. It's a beautiful area. And I can see that everybody is so well organized. And everybody is actually doing whatever job they're supposed to do so in an orderly manner. And, I can feel the positivity. I can feel that white aura, So basically everybody is actually so sort of well connected to each other. And I can feel that there's definitely, that positive vibes are going on.
Okay.
So that is definitely there.
The positivity was what caught your attention here.
Yes.
What was it about the conference today that, can I ask you, you would take back with you?
Well, as I said, mind, sort of management of the mind, management of ourselves, self-management is very important. Our priority management is very important. And again, as you have emphasized before, our lifestyle modification along with a well-balanced, healthy diet and positive thinking. And thinking always sort of in a positive way, good about other people.
Right.
Sort of seeing the positives of the other people is very important. And having a clean aura and maintaining that aura around us is very important.
Did you get a chance to learn Raj Yoga meditation as it is taught here, or maybe meet any of the senior Dadijis here?
During the inauguration, Dadiji, Janki Dadiji was there. Then Nirvair Bhaiji was also there. And the other Dadiji was also there. So they were all sort of all together today. All present today.
It's also said that laughter is the best medicine. And I was kind of wondering, is that something that you have looked into?
Yes, we do laughter yoga in the department on a regular basis. And laughter, as you can see, a small child, when he's born, he's actually he's smiling 300 times. We, in our day-to-day life, we've actually forgotten to smile.
True.
We've forgotten to sort of talk to each other in a nice way.
Yeah.
So, smiling, spreading the happiness is very important. IIT Kharagpur has actually launched the program of happiness, only on happiness.
Okay.
And the Vision 2020, which our late president had seen, Dr. APJ Abdul Kalam, he used to say that India will be a superpower with sort of sashakt mind, with our ignited minds. So it's very important that we stay happy, be happy, and make other people happy.
How wonderful. And Dr. Rawat, it has been such a pleasure talking to you today. Time flies, and unfortunately we are short of time today, but we would definitely love to have you back with us in our studio again. So whenever your busy schedule permits, please come back and visit with us.
Sure. Thank you very much for inviting me.
Om Shanti.
Om Shanti.
What a wonderful time we had speaking with Dr. Rawat today. She came from this place of inner depth where she talked about how positivity, laughter is the best medicine. Prevention is better than cure. She also talked about mind management. And there was a special concept that she talked to us about today, and that was sleep hygiene, where she gave us many tips about what to do to cure insomnia, not necessarily take the pills. I hope you've enjoyed this show as much as I did talking to her. And we definitely want to see you back again on this show next time. Until then, take care and Om Shanti.